Good morning, everybody. This is Peller from SRP, Strategic Response Partners. And with me in the studio here today at Space Coast Podcast, I have a special guest, Rob Baba from EMC Secured. Rob is an MRSA and MRSR. He's designated Master Restorer with the IICRC, and he is an indoor environmental consultant, certified trainer in mold remediation and cleanup. He has a wealth of knowledge about what we're going to talk about today here in the studio. And for those of you who have joined me before, Strategic Response Partners is a disaster response company, and we specialize in incidences such as COVID-19. So today we're going to talk about preparation and how to deal with this pandemic episode and prepare. And we're now going to be embarking on responding to it, and then the recover response part. Rob, good morning. How are you?
Morning, Peller. How y'all?
Thank you for joining me today. He came from Orlando. Thank you for actually changing your flight to Puerto Rico. He is going to be required to provide his services over there. Strategic Response Partners was over there during the hurricane. And thank you very much for adjusting your plans and spending just a little bit of time to talk about something super important today.
Not a problem, Peller. Thank you for having me.
Thank you. Could you tell me a little bit about some of your background, your MRSA and MRSR, so our guests today can understand where your knowledge is coming from and the advice and some of the data you're going to be supplying today?
Yes, ma'am. Well, my background is 25 years extensive in this disaster recovery industry, majority of it in environmental mold remediation, things of that nature, bacteria cleanup, biohazard cleanup, and that kind of thing. And as you all well know, the virus situation and this pandemic is all new to a lot of us. But we're making do with what our knowledge is and what we know how to do things.
Yes, I understand that the strain is changing and it's evolving, and there is two different strains of it, so it keeps mutating, that's what our situation is. We're really trying to get on top of it. And one of the most important things we're going to talk about today is, staying calm, focused during the time of crisis. And our job today, Rob, we're not talking about finding a cure, but we are talking about mitigating the situation.
That's
correct?
a key word, mitigation, Peller.
Exactly.
To mitigate is to do what? Is to stop the damage, to stop the leak, to stop the further damage and that kind of thing.
Right. And, it is in our industry that we stay on top of many reports from, infectious disease centers, organizations, and government, and we try to stay out of the mainstream data so that we don't create hype. I mean, our big thing is really staying calm. Prevention is key. So we know we have a problem, and I would liken it, if you can tell me where you feel on this one, it's like a gigantic hurricane.
Well, creating routines is important.
Yeah.
Preventive disinfection routines, things of that nature.
Right.
We all have routines in our home or in our business, in our environment. Every day in our environment, we do what? We clean. We do our dishes, we do our mopping, we do our sweeping, we do wipe downs, that kind of thing, right?
Right.
So in addition to that, planning and pre-planning for things of this nature creates a double-sided routine, what I call preventive disinfection routines.
Okay, excellent. And we do definitely want to let everybody know that as I was referring to, the hurricane is in the sense of it is all over the United States, and I don't mean we have a hurricane. I'm just saying we have an incident, and our incident is now covering globally. So we want to talk about that. We also, Rob and I want to talk about, we are specializing more on the commercial side. It's not that we don't feel that the immediate public and one-by-one individual is not important. That's not what we're saying here. What we're saying is when we take care of these larger institutions, they do give back to the community and provide the structure and support that we need. So our areas of expertise, Rob and I have been involved in several incidences, different states, different tornadoes and hurricanes and things of that nature. So if we get the infrastructure secured and it has the ability to provide back to each of the individuals in the community, we can get back together and get back on track quicker.
Exactly.
As a community.
That goes back to what we were talking about just a few minutes ago. Preventive disinfection routines, meaning every commercial building has janitorial service, maintenance service. Why not add a routine biohazard virus cleanup service as well, And that's basically what we're going to be able to do and accommodate it throughout our industry right now. Trained professionals that are remediators and mitigators are able to clean up after storms, after major catastrophes. This is a major catastrophe. When we call it a pandemic, that means it's worldwide at this point.
Yes, exactly correct. Mm-hmm. And I'm going to give a little bit of background on Strategic Response Partners. You guys probably have visited the website. If you haven't, I'm going to give you a brief background for us. Strategic Response Partners has responded to not only the H1N1 SARS MERS outbreak, it has the experience and expertise along with our certified environmental consultants such as Rob to not only, remediate properly, have those protocols put into place, monitor the entire decontamination and sanitization of the coronavirus, and then, we follow by the outline of the CDC. So it's really important. Rob said we have our daily disinfectant kind of a routine, but we are talking about having specialized teams led by experts such as yourself. And the reason why we do that is if you mishandle this situation, and Rob, this is where you're going to give me that information back. If we mishandle this sanitization, decontamination, the biohazard waste, and also how do we remove or dispose of this, we're cross-contaminating, correct?
Well, you're cross-contaminating if it's not applied properly. Understanding the project, first of all, each building and each situation is going to be different as anything else in life.
Exactly.
Understanding the life cycle of the virus is important. Transmission of the virus, mortality, symptoms, incubation period, means of transmission, and the type of occupants in that particular building. Knowing your client, basically, knowing the situation and understanding how long, if anybody's been infected in that particular building, anyone has been sick prior, even if they haven't been infected by the coronavirus. What are the normal operations, things of that nature.
Excellent. That's an excellent point. So let's talk a little bit about my gym. We'll talk about my gym just because it just came off the top of my head. LA Fitnesses around the country are closing. So those buildings now, people are taking a preventative measure. Let's say nobody was tested or swabbed. They closed as a preventative measure because we are social distancing ourselves. We're trying to break the chain, which I think is very proactive. And we're all about preparing. So that building, please tell me.
Perfect time at this point for that organization to put together a strategic plan of action, meaning bring in a strategic response partner program, bring in their professionals and that kind of thing to create a sound plan across the country, across their facilities to disinfect, deodorize, sanitize.
Excellent. So now, Rob, you would be one of those specialists that actually heads up this specialized crew in this building. You make sure that they've donned on their proper PPEs. We've got safety containment. You're running the protocols. And with that leads us to the certificate of clearance on that building. This building is now prepped and ready to go. And it has got, like a hospital clean room grade behind it. So when business resumes, this certificate is relieving that general liability should something happen in the future. Is that correct?
No.
Okay.
Let's back up a little bit.
Excellent.
All right. We put together a plan of action for that particular building.
Correct.
For, say, we call protocol. The protocol is going to say, this is the proper PPE, this is the proper containment levels, this is how if there has to be any removal of any biohazard waste or materials, this is how it needs to be addressed, how it needs to be bagged, that kind of thing, and disposed of by obviously a licensed professional. And then the remediation, as we call, commences, and we start with that. And after the remediation is complete, we come in and retest the entire area to make sure that everything has been secured. At that point, if the area is a clean room ready, we certify it. But that does not change the fact that as soon as the doors open, the environment changes. We cannot guarantee that the environment is going to stay that way, because let's say somebody else comes in that is infected. How do you maintain that? That is the question right now. That's why people are backing off and closing the shop.
Sure. So for that business owner, it would be advisable that they get in front of cleaning their building.
That's why
while they have time and resources, prepare the building, have it ready to go for when we resume natural life.
Exactly.
Okay.
And then it becomes a routine maintenance thing.
Excellent. Excellent.
That's why I mentioned that earlier. It's become part of your janitorial service or your maintenance service, your weekly, your monthly, whatever it is. Part of that becomes your sanitization and disinfection.
Yes. Excellent. So our ultimate goal with that is to obtain a safe to reoccupy.
Exactly.
Okay. Excellent. So let's talk about another one. We are working now with ALFs, so assisted living facilities. And I think some of the business owners, my biggest question that I came across was, well, we're in the facility and we are not letting anybody else in. So obviously our crews are coming in properly dressed. How does someone move about the building in that space? Because we do have people that are going to stay there. Also, let's talk about the prison system. Very important. We obviously know that they're occupied there. So could you address that particular building and that entity?
Well, that's two different entities, but first of all, the
assisted living
facilities. Mm-hmm. It has to be unoccupied. I cannot justify putting a solution or chemicals in a occupied area and not feel that someone would have adverse reactions to it. So that goes back to understanding the occupants and their health status and things of that nature. Maybe moving folks around.
I think you're being summoned back there. So let's talk a little bit about a report that I had heard early this morning. Somebody had visited back into the United States, and he was via obviously remote, kind of like we're doing, Dylan Ratkin, and he had provided a report about Italy. And he had said that something that's advantageous for Americans is that we are social distancing ourselves because it's like a big wave. We're waiting for it to come, or kind of like the hurricane. We know that there is going to come when we kind of crest up to the top of maybe cases. And he said, we have enough facilities in America, whether it be schools or whether it be colleges or universities, to set up for possibly the sickness coming for us. So these would be great facilities now that the colleges and schools have been closed down and we have a nice large size to prepare that facility should we need it. Could you talk a little bit about that?
Well, that's obvious. First and foremost, anything that we do in this type of situation, our work zone, what we call work zone, should be unoccupied. That perfect opportunity for us to be able to put together a perfect situation is by implementing the program in that kind of setting.
Excellent. So those anybody in the school system, superintendent, maybe in our districts would, if they're going to be considering to making those facilities available in our community, it would be a great time to get in touch with the appropriate company, one such as yourself, to get into the facility now, examine it, put together a plan.
And that's basically where SRP, where you guys excel, is actually creating that program.
Yeah. Thank you very much. I appreciate that. So, what we want to talk about is we're in the prepare, and we're going to be responding to something that's coming our way. And in saying that, you can send your building plans in. You can have your policies reviewed. From what I'm understanding, SRP knows that there is coverage out there, and these type of business interruptions and expenses for, proper containment or, proper decontamination of a building protocols. So that it's prepared, yes. And the protocols that go with it are what's needed in hand, and it's the time now to get in front of it. Would that be your advice? I mean, because obviously in 6 weeks, 8 weeks from now, that's not just my
advice. That's everybody's advice. That's common law, common knowledge.
Yeah,
it's best practice to be prepared and get this ready to go. I would recommend that, and I would suggest it to anybody out there, any industry, any facility.
Excellent.
Risk managers, your duty is to do what? Is to assess the risk, prepare the risk, and prepare the facilities for that type of risk. And bringing in an SRP and their partners, people like that, to facilitate that type of endeavor and to train your maintenance staff for long-term commitment.
Excellent. So in a few minutes, we're going to take a break. And when we get back, we're going to dive a little deeper into Rob's expertise. And he's going to tell us the importance of hiring the correct environmental consultant to head up the project of remediation. And I want to stress this. You just can't turn around and hire your everyday remediation company because of their proper equipment, their solutions. Licensing, exactly. And Rob's going to dive into that. This is great information, you guys. When we get back, please stay tuned. Get a pen and paper out if you need to write some checkpoints off for yourself in hiring your company. Thanks.
You're listening to Space Coast Podcast, home of the greatest podcasts on the Space Coast. If you're interested in becoming a sponsor or having your own show, email us at spacecoastpodcast@hotmail.com. Space Coast Podcast. Talk hard!
Are you in the market for a new home? Perhaps you need to sell your old home and downsize or relocate. Hey there, my name is Jesse Hall with eXp Realty, and I offer professional real estate services right here on the Space Coast. Give me a call, 321-877-8737 for all of your real estate needs. Again, 321-877-8737 for all of your real estate needs. Buy, sell, invest with the best. Find out more at 321-buysellinvest.com.
Join us for the fresh, new For Your Best Self podcast with Drs. Anita Saluja and Rebecca Novo of Dermatology plus Plastic Surgery. We will reveal the facts about techniques, trends, products, and procedures to be your best self. The first and only podcast combining the synergy of aesthetic dermatology plus plastic surgery. Search For Your Best Self on Apple Podcasts, YouTube, and Spotify.
Hey everybody, it's Peller from SRP, Strategic Response Partners, a disaster management company. And today we're talking about COVID-19 and we're talking about protocol plans and preparation. I have with me today in the studio at Space Coast Podcast, Rob Baba. He is from EMC Secure. So thank you, Rob, again so much for being with us. He was headed on a trip to Puerto Rico to assist them down there, and he has graced us with some time this morning. And on our second half here, we are talking about how to go about taking your precautionary steps and your pandemic preparedness. So as we left off, we want to emphasize you cannot just go out and hire your everyday remediation company. And I'm sorry, I know we might have some local, relationships here, but when we're talking about the liability that is behind this, we're talking about the seriousness of this strain that just keeps mutating. And so it is very serious. You're going to have to bring it to the next level. Correct, Rob?
Correct. And graced is a strong word, but thank you.
Rob and I have been in a multitude of different situations. We were out in Wilmington, North Carolina, and that too had its own incident.
Pig poop.
Yes.
Pig poop.
Oh,
Pig
yes.
poop.
God bless. The waters rose, and unfortunately, those little animals did not make it. And an episode began through that. It was the waste and the hazard behind it. So he has a lot of experience. That's just one of a few adventures there. But as we focus back in on COVID-19, Rob, please tell me, I mean, you are the specialist that heads the team up. You've got the protocol on each individual entity and envelope because they're all different.
I'm glad you said the word envelope, because understanding the building envelope and the building science behind that envelope, understanding your HVAC systems and how it operates, a trained professional has to understand that. Not only has an understanding of the process, but understanding of the building itself and how it's pieced together.
Yes, exactly.
Is key.
And your PPEs. I just saw the Senate break, and they had a bunch of people in there wiping things down. And I just have to say, I love the enthusiasm. I love that they're giving something. I love everybody's washing their hands. We should have always been washing our hands. But
I washed them a few minutes ago.
We did. We have sanitizer in the studio.
Yeah.
But having your proper PPEs, I've seen people wearing gear, they're donning gear, they're passing out, they're not doing, it's crazy. So they're creating a little bit more of a problem that they need be.
Understanding your gear is just as important as understanding your building. If you're not gear ready, meaning if you don't understand how to don and doff your gear, put it this way, with this beard, I'd have to shave it off before I put on my PPE.
Okay, so that is amazing to me. Like even the smallest details, we have to understand what goes into that. So could you maybe tell me, some of the things if someone was to hire somebody inexperienced, what their repercussions are? This is probably a great way to put it, because we really want to know the ugly side of that.
When you say repercussions, it's
life-threatening at this point.
If somebody doesn't understand, once again, all the segments of what's going on, all the components, One, your building envelope, the building science behind it, the situation you're dealing with, meaning this situation, the COVID-19 and the coronavirus, understanding how to deal with bacteria, understand how to deal with microbial contamination, understanding how to deal with those kind of entities. If you don't have knowledge of that, in my opinion, you need to find someone that actually understands that process and has a full background, and their staff and their personnel are all OSHA trained and certified.
Yes, and that is a great point. We have strategic partners throughout the nation that have those certifications behind them. There's also proper licensing that you have. You have proper equipment that is used at the facility.
And remember, proper equipment doesn't always guarantee the good work. The equipment that is utilized must be maintained efficiently and appropriately. I've seen projects where people have equipment with filters, and I hate to say this, I hate to even say it, thinking back about it, that have not been changed out from project to project.
Oh
so what are you doing? You're moving one situation to another situation.
Yeah.
Things like that. That's why people like me are on site. That's why people bring us in to facilitate and create oversight on a project.
Excellent. Yeah, cataloging that, checking in the equipment, making sure that everything's clean, because that is just a layer upon layer of disaster. I mean, definitely that can create that. And then also the disposal. I mean, we were in the Panhandle together, and I will tell you, I saw a building and all of the debris was actually unbagged, and it was asbestos. And it was a big company that had done that, and I just couldn't believe it, and it was still sitting out there. So let's talk about, moving on to this side of the spectrum. What could happen if a company, mishandled the bio-waste or,
Meaning the company that has been hired by a building facility or the building facility itself?
Let's talk about both sides. Thank you.
Well, let's put it this way. The contractor holds liability when they sign they sign a contract with that facility owner or management company. Mm-hmm. They assume liability of the building. Okay. So when you are removing asbestos containing material, lead-based paint containing material, mold contaminated material, bacteria contaminated material, or in this situation, the virus, if you're removing anything like that, you've assumed liability. And when I say liability, not only the fact that it's coming out of your pocket eventually, it's the moral aspect behind it and the ethical aspect behind it.
Yeah, this is life. This is what we're talking about. You're
our
talking about
our
lives.
job as a professional, and my duty as a professional is actually a duty. It's not even my job. It's my duty to honor that commitment to helping and assisting people and servicing.
Okay. And as for our building owners, let's talk about them. It is their due diligence. I mean, they have a responsibility behind that in the workplace.
To their occupants, to the workforce. Not only do we have to understand OSHA regulations for worker safety, but it's also for occupant safety.
Yeah.
It's not just a regulation just for the workers, but also for the occupants in that facility.
Excellent
It doesn't just go to construction workers. Remember that, folks.
Right.
Not just for construction workers.
Right. And let's talk about maybe on the civil side. I mean, our law enforcement and our fire departments. I mean, that is also very important to them, too. I mean, we really need to talk about they're out there in the field. They're the first responders. Even their own facilities probably need.
Think about their vehicles. That, to me, is crucial. Think about the folks that are coming in and out of their vehicles. Who knows?
Right.
So maintaining that, once again, that goes back to the preventive disinfection routine. Maybe create a disinfection routine with a fogging, with a wipe down, that kind of thing on a routine level.
Right. So a protocol for them, even in their own daily activities, is they have to still put themselves out there on the line.
Exactly.
Which,
yes, ma'am.
We honor them. We honor those guys and gals for sure. Thank you very much for all your service every day and every night.
That's
for
right.
Sure.
You guys are heroes.
Definitely heroes in our book for sure. So, Rob, let's talk a little bit more about maybe what would be at the top of your point of mind to bring to the public.
Understand what we're dealing with.
Okay.
And understand what can be, not what it is right now. What can be, and how we can create a long-term plan. That's key.
Yeah, and I think that's a great point because we're at the infantile stages of it. I mean, we're only, I guess, estimated maybe 9 to 10 days behind what Italy is, but we've still got months in front of us where they're perceiving that we are about to have like a surge in the wave, and we're really trying to flatline what's coming our way, and we're doing that through that social distancing. We're doing it with this building preparation. We're trying to give some information to you guys that is extremely helpful. This is, getting in front of it and really securing your community. I just think it's the right thing to do, and I think this message today is the right message to have. Staying calm and focused in the time of crisis and mitigating the situation at hand so we can stay on task and get back to our everyday lives, and maybe with a newer understanding of what we have here.
Touché. Exactly. Remember, we're not scientists, but we listen to scientists that work with the CDC and people like that, and we even follow the EPA guidelines, things of that nature, in remediation protocols. That's why we do what we do. We follow the people with knowledge. We do, and now we're asking you to follow protocols that we put in place that cover what the scientists give us as an understanding of what we're dealing with.
What particular licenses should somebody carry? I know even actually out on the road you need licenses, so maybe you could give me a little bit of maybe background on that so that our listeners could hear.
Let's put it this way. Not every state requires a license for mold remediation, things of that nature, but there are a few out there. But certifications and designated understanding of what you're doing.
Excellent. All right, so we're going to go to a quick break, and then we're going to conclude for today. And we thank you for joining us throughout our program today. We always want to give some public service to the communities and get in front of our situation as a disaster management company. And stay tuned. We'll be back in a few minutes. Hey guys, it's Peller from SRP, Strategic Response Partners, Disaster Management Company, and we're at Space Coast Podcast today, and I have with me my special guest, Rob Baba. Rob, thank you again. He did reorganize his plans from Puerto Rico to join us for a little bit to give some great information to all of our communities. I asked everybody, please share this information. SRP is global. I serve domestically throughout the United States. We have partners in every city across the nation, certified partners such as Rob. They're heading up these specialized teams. We are talking today about COVID-19, and we're talking about pandemic preparation, how to secure your building envelope in a forward-thinking capacity. We're going to conclude today. We went over some great stuff, some great information in there. We ask that you reach out to us at SRP, so Strategic Response Partners, srp24.com. We have a 24-hour live dispatch at 888-582-5848. You can always connect to me either via Facebook, my Instagram, or LinkedIn. I'm on LinkedIn all the time. Through there, you can get in touch with Rob as well. He is one of our leading specialists especially in the area that we're talking about, COVID-19 today. And Rob, would you like to wrap up with some stuff for the public, please?
Yes, ma'am. Well, thanks for having me again.
Pleasure.
But one thing that I really want to say is the importance of understanding the building that you're dealing with and understanding the potential health risk and the liability that we're dealing with. When I say liability, I don't only mean your pocket liability. I'm talking about ethical liabilities and moral liabilities. How do we plan? How do we prepare? And who do we bring in to help us facilitate the situation are important. And understanding who those folks are and if they have a plan, like you guys, like the Strategic Response Partners.
Exactly. So, again, I will tell you, you can give me a call. You can call even into our dispatch number. You can set an appointment up. You can send over the building plans. We can set up some pricing sheets for you. We could talk about some plans for you. At this moment, half the country, 3/4 of the country is actually going remote. And so we can do everything via the phone. You don't have to get out anywhere. We could, with those building plans, create a plan for you and then actually start commencing and getting on to cleaning the building and getting it prepared. Right, Rob?
Most definitely.
Absolutely. And then you're prepared for reoccupy. And that occupancy with your clearance is very important. Takes that liability out of it for the asset owners.
That's where you get your validation of things have been done properly. And not only having that, is having a team like the Strategic Response Partners, EMC, people like that actually are creating an oversight of the project. You're not there just to put together a plan and say, do what you have to do to get it done. You're there, you're monitoring, you're creating oversight, and you're validating the situation as it goes along.
Absolutely.
And you're training and you're teaching as you're moving.
Yeah, so we are executing that entire process for you. So, reach out to us. We definitely would like to help you. I think, to me, I always say a cup of coffee. At this point, it's really just a phone call. We're having virtual coffee with everybody. Sip. Is worth $1 million, and it's about saving lives. And that's our first order of business that we're in business to do, is to save lives. And so this is kind of where we're at today,
Being prepared is being excellent.
Yeah, definitely. Well, thank you so much. I want to thank Rob Baba for joining us today.
Thanks,
and we look forward to seeing you. I will be doing some webinars and a couple of virtual checkups as we go through. Rob, good luck to you in Puerto Rico. Be safe out there.
Thanks,
we want to see you come back. We have a lot more things to conquer in this world together.
Yes,
okay?
Ma'am. Yes, ma'am.
Excellent. Thank you, everybody. Please be safe. I look forward to connecting with you.
Thanks, guys. Out.